Sir, one more doubt, sir.
Hmm.
How long should a single case study be taken? Means, usually, for example, if I take a Omicron case, now it
Huh?
is Omicron case study.
Okay.
So we are taking it. So
Hmm.
it is in the early stage, so we'll be just noting down all the symptoms that person is having and going on elaborately. But at what point of time can we stop the study, or can we say that these are the findings? Like,
A case study is mainly to monitor the health status till he recovers. Till he
oh,
recovers.
okay.
Till he
Till that
recovers.
time, we have to keep
Yeah.
on.
You have to continue.
Okay.
And several times he will undergo RT-PCR and other tests, whatever that is needed.
Yeah.
Till he recovers, maybe 1 month, 2 months
Yeah.
time, I think.
Okay. Thank you.
Good evening, sir.
Ah.
Sir, my friend trying to join, but she can't, sir. Allow her, sir.
Yes. The next unit is it visible to you?
Yes,
Unit
sir.
Yes, sir.
Yes, sir.
So this is about
Yes, sir.
design strategy in research. And what are analytic studies? Differentiate between the analytic and descriptive epidemiological designs. Actually, this analysis takes into consideration interpretation of the results. And here, descriptive is only describing a new thing or whatever that is appearing there in the population. Here we cannot draw conclusions or inferences, but here we can draw conclusions and inferences. And we can classify different designs in the forthcoming pages. And what are the different types of analytical studies? And enumerate strength and weakness of the analytical studies. Elaborate on the issues to be considered in the design and conduct of experimental studies. So if you look into this, earlier also we have seen that analytic study where the data can be analyzed. Analytical study where the data can be analyzed is of two types: observational study or a field study, and the experimental study where the experiments are conducted in the lab. Here, most of the times, experimental study needs animal models, either mice or any other pigs, mice, and other experimental, or a plant as an experimental animal. But most of the times for human populations, we go for observational study. Why? Because we have limitations to conduct experiments on man. And when you want to conduct experiments on man, there is one concern which is called ethical concern. So, what is ethical concern? Can anybody say what is ethical concern? Today we are facing with a lot of ethical concerns. What is ethical concern for man? First of all, we don't have freedom to use man as experimental animal. Even if you want to take man as experimental study, you have to take informed consent. What is informed consent? You have to explain what are the problems to be faced in the project and what is the benefit he will get. Or if at all, if health is disturbed, what are you going to do? These are all the questions to be asked, answered. After he convinced that it is not going to harm him much, then he will volunteer to come to become a subject. And there is a big procedure where you have to formulate an informal sheet consent form. And first you have to give subject information. Subject information is the information on the research project. Then you have to take the consent. Even if you want to take a blood sample or urine sample or any tissue sample, you need to enter into an agreement that is called consent. Without consent, we cannot touch a man. Even if you take 1 ml of blood or just to take a drop of blood also, ethical concern is interfering. But in olden days where there were no regulations, we used to prick the fingers to test malaria or to test anemia and all. But nowadays, because of several unhygienic conditions where the subjects got infected and where they developed into casualty and all, no, it is not advisable. So first of all, you have to enter in an agreement, which is called consent. There you have to clearly mention what are the terms and conditions of the study. If he is convinced that it is not going to affect drastically, he will himself volunteer. So that is needed. So then human being can be considered for experimental study. And another channel for experimental study for human genetics is hospital. Suppose a person is admitted into the hospital. While admission procedure itself, they will take consent from the patient himself or the attendant who is coming with him. And there is a declaration form where they declare that we are giving right to a doctor to see him. If anything untoward thing happens, we are ready to accept it. That is even while performing surgery, I think most of you have given agreement or consent to the hospital, stating that if untoward emergency comes out of the procedure, we cannot sue them. That is the agreement which is made. So these are all the things when human being is considered for experiment. But otherwise also, even after admission of the patient, if any research investigator goes to find out the symptoms, medical treatment, doses, etc., you need to take the consent. One consent is from the doctor, from the hospital. Another consent he has to give to the research investigator who is visiting. Only then an investigator is permitted to take the data. And another issue of ethical concern is confidentiality. Confidentiality in the sense, without permission of the patient or his relative, should not disclose what is the problem. Whatever the data you are generating, whatever the problem you have recorded, should not be disclosed. This is because a right to confidentiality is to maintain. Patient has the right to maintain confidentiality. So that need not be disclosed out. But
Excuse me, sir. So sorry to interrupt you. Some of the students are waiting to join the class, sir. Please let them alone.
So I was explaining about interventions and experimental studies, especially dealing with man. You need to take the procedures are there. Otherwise, we cannot touch human body. We are not allowed to touch human body and take sample unless they provide consent. Otherwise, just it becomes an observational study. Without intervention, you just ask questions like a questionnaire, research schedule, or interview. That is called observation or field study. Observational studies are again divided into cohort, a group which is of similar characteristic. You can divide the population into cases and controls and make a comparison. Yeah, this is called case control. Most of the PhD scholars will take up this particular model. Most of the PhD thesis, those who are doing PhD, they will take a few affected cases and few control cases and compare. But when you take these cases and control, you have to match for age and sex. You know what is matching for age and sex? Can anybody say what is matching for age and sex?
All the subjects have to be of the same age and same sex.
Not exactly. Suppose if our case, if there are diabetics, let us say, you have taken diabetics pertaining to age group between 35 to, let us say, 60 years. And you found a cross section of the population where the range is 35 to 65, right?
Yes.
But when you need to control, when you want to compare this with the healthy people, control is nothing but healthy population.
Yes, yes.
There also you have to match. You cannot take a person who is 25 or 10 years, 18 years. You have to match. That means even control population should be made of 35 to 60 years. That is matching. Another matching is if diabetics population is made up of, let us say, 60% males and 40% females.
Mm-hmm.
Same ratio should hold good here also.
Control group also.
Even in healthy population, you should be very careful by taking the numbers. So it should be again 60% and 40%. Then only you can call it as matched control.
Okay.
Otherwise, your interpretations will be wrong. So you should match for age and sex. And I gave the examples, but there are several other matching considerations which you will understand when the research project is going on. Suppose in cases there are vegetarians or there are non-vegetarians, a same number of vegetarians you have to like that, depending on the categorization. If you want to see the effect of vegetarianism or non-vegetarian food habit, let us say there are some non-vegetarians here. Same number of non-vegetarians you have to select here also. Something like that. Okay, now? And here, coming to cross-section, it is just a part of the population which is taken for this study, but not the entire population. It is like a sample study, and it is only one-time study. It is only one-time studies. But this can be there in analysis or description. If it is there in the analysis, you can interpret the data after statistical analysis. For example, you can apply SPSS, get the results, and interpret them. If you just describe, it becomes descriptive cross-sectional study. Otherwise, it is analytical. That means there are two types of cross-section studies, either descriptive or analytical. So these are the three experimental study designs for studying relationship between maternal anemia and birth weight. So the birth weight, generally we take 2.5 is standard for Indian population. It is lower, we call it low birth weight. And greater than or equal to, let us say we take it as normal. So here maternal anemia is yes or no. They will answer yes or no. Maternal means mother's health status. So what we expect, if mother is anemic, probably the growth is affected and the weight will be lower than expected. So these are some of the considerations. Cohort, we are taking all the newborn children in a hospital. That is a cohort. All the newborns born in one particular day or one particular month, that becomes a cohort. But you have to define the cohort. Are you looking into all the babies in one day born, or are you taking babies born over the entire month? That is your cohort. And follow them up. So you have to define the cohort. Are you taking only babies born in that particular day, or spread over 1 week, or spread over 1 month? That is your cohort. And when it comes to case and control, as I told you, we divide the population into two cases whose mothers are anemic and whose mothers are normal. And see the birth weight, what happens to birth weight. Cross-sectional is one-time study where we don't follow it up. And again here you see maternal anemia present or absent. Here we don't bother case and control. Here we divide the population to case and control. Here we take all anemic people, all the mothers during that particular time of investigation. One time, you have gone to the population at one particular time. During that time, you inquire the mothers who have given birth to children, those who are, and ask whether they are anemic or not. This is cross-sectional study. Here we don't include healthy or there is no categorization of cases and control. Cross-sectional study or screening to exclude those with the condition. Reference population free of condition. And from that you take a sample without the characteristic and with the characteristic under. First you start with cross-sectional study or screening to exclude those with the condition. Reference population free of condition. This is the part of the population. Then you take a sample, and from this sample you take without characteristic and with characteristic. And then you observe whether they are developing condition or they do not develop the condition. Because we are taking all healthy subjects here. We are taking only healthy subjects. And this is called reference population, where there is no condition initially. and you have taken sample, divided them into without characteristic, with characteristic. Then we are going to see whether they are developing condition or they do not develop. So we lay certain condition here, characteristic. Does it lead to any problem? Here also, does it lead to any problem? So here we have to answer these questions. So whatever we have discussed earlier. What is analytical study? List the various analytical studies we may carry out while undertaking epidemiological research. Whatever the table that we have just observed, that is a table of analytical studies. What is the objective of conducting cohort study? Look up any reference or book or journal, internet. Give one example of a cohort study undertaken epidemiological research. Explain the process involved in case control study. List any 2 advantages and 2 limitations. Just go through them. Try to answer. Differentiate between descriptive and analytical, which you already have discussed. To answer all these questions, the points are already there. So here, experimental and intervention both go together. Intervention means when you are intervening with the human body. Either you insert a needle to collect the blood, that is intervention. Or you are collecting urine, that is intervention. That will lead to an experimental investigation. But non-intervention, when you just take information, that becomes non-intervention. By interviewing without touching human body. Here, one therapeutic trial, which is called interventional study. Patients of tuberculosis, which are bacillus positive, randomly allocated for long-term treatment and short-term treatment. So these people who are already identified with the positive bacteria, they are randomly allocated for long-term treatment, short-term treatment. And then after the treatment, how many were still bacillus and how many are bacillus negative? Here also, after short-term treatment, how many are positive, how many are negative? This is called a therapeutic trial. Here, a particular drug is given. Long-term means it is, let us say, for 3 weeks or 4 weeks. Short-term for 1 week. To see what is the efficacy of the drug for 1 week and efficacy of the drug for 3 to 4 weeks. If the drug is really efficient, they will recover in the short term. If the drug is not much efficient, it takes longer time. Or one more factor, if bacillus develops resistance to antibiotic, and naturally it needs long-term treatment. If it is sensitive, within a short time they can get cured. So these are all the different considerations when you conduct a therapeutic trial. You can also extend the trial to community level, preventive. Community with the deficiency of sodium fluoride in water supply. Community with the deficiency of sodium fluoride in water supply. And you take from 2 different populations, allocate randomly, and give no sodium fluoride in water supply. Sodium fluoride in water supply. And see whether there is dental caries formed or no. Here there are 2 consequences. Either they develop dental caries or they do not develop the problem. Similarly here, after allocation, sodium fluoride in water supply, here no sodium fluoride is given, but still there is a problem of dental caries. And here, sodium fluoride in water supply. So we can attribute the different causes of dental problem. Why? Because it is not only due to sodium fluoride. It can be due to other causes. So to rule out how much is contributed by sodium fluoride to damage the teeth is reflected here. But this is a case, something like comparison or control situation, where we are not giving sodium fluoride, but still dental damage is observed. But what we expect out of this model, we find a more frequency of caries here compared to this situation. This is an unattributable random development. This is attributed to a specific cause. Here, the no cause is associated because we are not giving any fluoride in water supply. Here we are giving fluoride in water supply. And here also, you will get an idea whether it is preventive or not, because we are filtering out water, how much it is efficient. We are ensuring that water is not made up of sodium fluoride. We are thinking like that. But still, dental caries is present, then you have to check the water. If it is a higher incidence here, you have to check the quality of the water. First, you have a reference population, a target population. Then you have to reduce it to experimental population by sampling. And some of them will become non-participants. Because why some of them become non-participants? Can you guess here? Here, why there are two types, non-participants and participants. First, you have gone to a target population. Am I audible to you?
Yes, sir.
Yes, sir.
Yes, sir.
So that is reduced to experimental population for your objective. You are aiming at experimenting this population, but again, at third stage, you are dividing them into participant and non-participants. Do you know the reason why there is a non-participant and participant here? What happened here? Can anybody?
Maybe we cannot take all the people into consideration. The data will be very large to go through.
That we have cut it down here. No, reference population is cut it down to experimental. This sampling is over.
Okay.
But even a small sample again is getting divided into two.
Bias, sir?
Huh? Can you say what is it? Why is it? Can anybody guess?
Yes, sir. Bias?
For comparison purpose, I think for the treated people and for the non-treated people. However,
that could be one. And one more is, as I told you, whenever you are intervening a person, you need to take informed consent. Those who don't give consent, they become non-participants. Those who don't give accept to be volunteer, they become non-participants. And all the others, they become participants. But of course, you can also have a comparison between these two populations because they may become control for this study. But after removal of the non-participants who are not willing, again these participants will be divided into treatment allocation. The participants becomes your study population. Why? Because some of them are removed because they were not given consent. So main criteria is consent. If they don't give consent, they become non-participant. After they give consent, that becomes a study population. After confirmation of the consent, only that group becomes your study population. But that study population has to be allocated different treatments. So when you allocate a treatment, it becomes treatment group. Untreated becomes comparison. This is where the control comes into picture. This is exactly the control. This is not the control. This is only removed out because they did not agree. But the control is here. You yourself are maneuvering. To one group, when you divide into two parts, to one group you are giving a treatment like a drug or a nutritional supplement. And to the other part, you are not giving any supplement or drug. So this is very important. You can take it. And several times it is coming in the exam also. How do you get a case and control? This is case and control. How is it? First you take a reference population, then reduce it to sample size experimental, then filter it out based on the participants, non-participants and participants. This becomes your study population. Out of this study populations, you are again two groups are there, treatment and comparison. So this can be a case and this can be a control.
So the control group is given a placebo like?
Placebo, yes. Placebo can be given. Yeah. Placebo can be given or don't give anything. Placebo comes into picture when all the individuals are suffering from a problem. Let us say hypertension or diabetes. There you divide the patients into two types. To one you give the drug, to other one you give placebo to see the psychological effect of the people, whether they are really feeling that they are recovered or they are feeling that they are taking some tablet, to what extent they are getting cured.
That is double blind, okay?
Yeah. Otherwise, if you are studying effect of a nutrient supplement, here you need not give any supplement here. You need not give placebo. Placebo is when all of them are suffering from a problem. But here you have gone to a healthy population. To one part you are giving some nutrient supplement, protein-rich diet, let us say. But here you are not giving that diet. So how much weight gain or the other parameters compared to this? Here placebo need not be given. Placebo comes into picture when you take the entire population of diseased people. Here we are taking healthy people. Why in diseased people you need placebo? The patient feels that I am taking some pill. And it is almost double blind. The doctor does not know what the drug is given.
Yes.
That is randomized somewhere without the knowledge of the doctor, without knowledge of the patient. It is called double blind study. Only researcher will know who is given what. Yes. Even doctor doesn't know. Okay, na? Yes. To remove the psychological factors. Okay. So here knowledge level of participant is important. Whether in intervention or non-intervention, both the cases, knowledge is very much important. Why? Because that influences the observation. So whatever question you are asking, is in a position to answer correctly, that is depending on his knowledge. So you have to assess the knowledge and frame the question in such a way that you elicit correct answer. Knowledge level, intellectual level, educational level, these are all the things you have to consider here. Why? Because they influence your observation. Whatever observation we are getting from them will be influenced by the factor of the knowledge. So if there is an influence because of the knowledge of the patient, that leads to biased inference. Biased means not balanced. It is in favor of one particular truth. Is in favor of one particular phenomenon, that is biased. Outcome may not be correct. Why outcome may not be correct? Because the information given by the person may not be correct. So all such things should be filtered out properly to get correct information. Just now I said single blind, double blind. Single means doctor knows here. Double means both doctor and patient do not know. Triple means even research investigator will not know. That is triple. That means research investigator gives the information to somebody to randomize. So why? Because sometimes research investigator may be biased in observation. So it is triple blind. But this is very difficult because you need a third person who is doing this randomization process. But it is taking time and you need many people in this. So here it is given that there are three levels. Subject, the person who is treated, subject, single, double, and observer, these two plus, and data analyst only knows about it. That is triple blind. All of them do not know that is triple. Both of them do not know, but only data analyst knows. The data analyst is the person who has the information, which is not known by the subject or the observer. So plus blind with respect to subject's allocation, may be aware of subject's allocation. Here blind with respect to, here subject is blind, and in the case of double, subject is blind, observer is blind. In the case of triple, all the three are blind. In the first case, only subject is blind. Subject means the person who is treated. Second level, subject is blind, observer is blind. Observer you can take it as a doctor. But in third case, subject do not know, doctor do not know, even data analyst do not know. That means there some other person is involved in allocation. All the people do not know. The hierarchy is subject, observer, a doctor, and data analyst. Methods of sampling, there is a probability sampling and non-probability sampling. Here, this depends on the probability of including a particular individual. And non-probability means you will exercise your own choice. That is non-probability. In the case of probability, every individual is likely to be included. Here, all the individuals will not be same to be included. You will set up some criteria. That is non-probability. That is, human brain is involved here to categorize. Here, human brain is not involved. It is totally statistical. Probability, it is based on probability. Non-probability means a research investigator will exercise his choice. If investigator exercises his choice in selecting, then it becomes non-probability. And here, a big population can be represented by a sample if it has representativeness and adequacy. Basically, these two requirements are needed. It has to be representative and adequate. The nature of the population has to be interpreted from a sample. It is necessary for the sample to be truly representative of the population. Moreover, it calls for drawing representative proportion of the population. The population may contain a finite number of members or units. Sometimes it may be infinite, countless, as in the case of air pressure or at various points in the atmosphere. A physical example is given. A population has to be defined clearly, so there is no ambiguity as to whether a given unit belongs to the population or not. Otherwise, researcher will not know what units to consider for selecting a sample. We want to understand infant feeding habits of mothers. Now let us take one example. We want to understand the infant feeding habits of mothers. Here, the population is not well defined. We are not told about the background of the mothers that have to be included in this survey. Maybe the mothers from rural, urban, slum background belonging to different socioeconomic groups, adopting different practices. So you have to define the problem here. That is called representativeness. Why? Because when you are looking into the practices, feeding practices, it may differ from a rural to urban situation or slum area. But when you are going to take a target population, you have to restrict yourself to a particular unit, a defined unit. Let us say you are concentrating only rural populations, or you are concentrating only urban, or you are going to the slum. So that should be clearly defined. Then it becomes a true representative. Or if you take some rural, some urban, some slum people, that is not a correct representation. Because there is a variation of the knowledge of practices here. So we cannot club together. You have to clearly define and delineate. If you club, the conclusion will be wrong. So representativeness is, you define the population correctly. That is representativeness. Your definition of the population should be right. Whether you want to select urban population, go with only that population. Or if you want to go with slum, go with only slum. But later on, if you want to compare, you should have one sample of rural, one sample of urban, one sample of slum. That is called stratified sampling. But if you mix up all of them in one sample, that leads to wrong conclusions. So representativeness is very important. And adequacy, the number of individuals selected for sample should be adequate in number. It should not be too low number or too high number, where there are certain formulas. Yesterday you asked about formula. There are formulas to calculate. What is adequate, what is optimum size is calculated based on the formula given by statisticians, which is based on standard error of the parameter, either incidence or mean value. Sampling unit is the individual who is considered for the study. That is called unit. Let us say you have taken 50 individuals as your sample. Each one is called one sampling unit. So how many units are there? There are 50 units. Or they are called units of inquiry or the subject. And what is sampling frame? When you have a big list of individuals, that is sampling frame. You have a list of people in a particular village, let us say voter list, that is a sampling frame. Or you select some names, develop a list. The list which is developed by you is called sampling frame. Generally what happens, you go to a village, take electoral roll, from that you randomly choose individuals. Let us say you have taken 100 people. That list of the selected people is called sampling frame. The list of selected individuals is called sampling, or list of selected sampling units is called sampling frame. So don't get confused. This is referred to one individual. This is referred to list of all selected, which is called frame. Sample size should be adequate, not too low, not too high, and formulas are provided for the calculation. And here there is a difference between parameter and statistic. Parameter are already established. Statistics has to be estimated. So this is referred to a population. This is referred to a sample. For example, what are parameters? These are established facts, established truth. If you take simple example of medical report, they estimate your hemoglobin. That is statistic. But again, there is a standard value referred. That is parameter. The normal ranges are parameters. But how are the parameters established for a population? Long years of experience and large population studies, they establish parameters. A physician or a doctor, out of his years long, maybe 20 years or 30 years of experience, and studying a very large number of subjects, he will fix up a parameter. They are called guessed values for a given population. So all these parameters are already established. The health standards are established. They are called parameters. So when these health standards are already established, they are reflected automatically in the medical report. Why? Because whatever estimate you have done through sample test, which is called statistic, that is compared with the parameter. Why do we compare statistic with parameter? To understand whether he is lying in the range given by the parameters or outside the range. Outside the range means too low or too high. It can be too low or too high. Sometimes too high parameters are also dangerous. So such quantities of interest are called parameters when calculated for the entire population. But statistics when calculated for a sample, a single blood sample. So after testing any blood sample, a medical reporter will provide you all the parameters to check back and interpret. Okay, he will see that the value is within the normal. Then he will not be panic. He will not get alarmed. But the value is not lying in the normal range given in the report within the parameters. He may get alerted to visit a doctor, or he will take some precautions. Let us say fasting blood glucose ranges from 70 to 100. The patient who is diabetic, he will be happy after treatment that his value is lying between 70 to 100. But even after treatment is not lying in that range, there is some problem. Again, that treatment has to be revised. So that is where parameters are playing an important role. Sampling frame, list of individuals, the sample size, the number of individuals needed for adequate representation. Sampling is the process of selecting individuals. Simple random sampling or unrestricted, which is just drawn with the chits, or you can use random tables which are available. So this is the random table. We put randomly at one point and go on selecting the values in the row or in the column. This is the column where you take all the numbers. But while taking the numbers, let us say 83 is crossed, 75 is crossed. That means your sample units are not 83, so you cut it off. That means your sample is less than 75, so 83rd individual is not there, so you cut it off. And 75th individual is not there. Why? Because your maximum sample size is only 60. So out of 60, you can select 53, 45, 33, 126, for which you need to index all the people in the selected individuals. Whoever is selected, you have to give numbering 1, 2, 3, 4 like that. And random tables will provide a random point. You put a pin here, random point, move on like this. When you move on, see whether this number is there within your sample frame. This is not there in the frame. because you have maximum 60. So cut it off. 53 is there, include 53rd individual. 48th individual is there, include him. 50th individual is there, include him. Like that. 75th individual, put a cross because you have only 60 subjects. And what are the numbers that are randomly generated? This forms your sample, random sample. Stratified, I already explained several times. When population is heterogeneous, you have to divide them into males and females, or community-wise or caste-wise for comparison. Systematic means every 10th individual in the population is selected, or every 20th individual is selected. For easy selection, easy process, less time taking. But this is less efficient than the earlier methods. These are more efficient. This is okay, easier. This is easier, but less efficient. For example, if there are 1,000 individuals in the population, we want a 50 sample size. So what will you do? Randomly we select first individual. Afterwards, every 20th individual is taken. Why? Because n is 1,000 divided by required sample is 50. So capital N is population. Small n is sample. So you are getting the value 20. That means every 20th individual has to be selected. This is easy, very easy, without randomization. That's why it is called systematic. It is not random. But conclusions will not be efficient like what we have done here. Less efficient test. It will lead to a research project, but conclusions are not up to expectation. But if a person who wants to complete it very fast, sometimes hospitals use it for rough estimate of scheduling a treatment, where they take every 20th individual or every 50th individual for their consideration to make the process faster. Cluster sampling, when you go at a very large, let us say a country is studied or a state is studied, you don't select individuals, but you make clusters. A village is a cluster, primary health center is a cluster. Like that, you include the clusters, not the individuals. That is called cluster sampling. So you go on reducing the population. Let us say you are going to study anemia incidence in a particular district. So you have to randomly take all mandals in the district as clusters and select only few mandals as clusters. But if you select one cluster, all the individuals in that village or the cluster should be included. This is also similar to cluster sampling, but in the multi-stage, in the last step where you select village as a cluster, again you randomly select only few individuals, not all the villagers. That is the multi-stage. The difference between cluster and multi-stage is here we include a cluster and include all the individuals of the cluster. If you select one cluster, a village, you are going to include all the individuals of the village. But in this, again you select individuals, human subjects randomly from a cluster. That becomes multi-stage. Probability proportion to size sampling. Here, when you are going for a sampling, depending on the size, you have to fix up a proportion. Let us say 10% of the population or 5% of the population. You need to calculate based on the size, get a proportion, and that particular proportion you have to roughly, it is a crude estimate. Instead of calculating sample size, you fix up a proportion. Okay, if there are 1,000 individuals, let us say 10%. What is 10% of 1,000? You calculate that and take only that many number. And here, purposive sampling, where you don't randomize, is one in which no random component is present and specific subjects are intentionally included. Volunteers are an example. So here, sometimes volunteers are needed to test the efficacy of a vaccine or efficacy of a drug. This is called purposive. In the case of purposive, it is not random. Somebody should volunteer. Only that volunteer is included in the sample. It is not. It is based on a purpose. It is not random. Why is it not random? They will not be agreeing to participate. So volunteers are needed. So one of the examples is volunteers for drug trial is purposive sample. Or if you have diabetic categories, you want to see effect of insulin on insulin-dependent diabetes. There you don't include non-insulin dependent. So you take all insulin-dependent cases because it is a purpose, highly focused, specific cause. Incidental sample is here an investigator employed in UIGNO, for example, may select learners enrolled for the master's program while conducting a study on higher education. Incidental means naturally occurring, because when you are targeting to study efficacy of a program, incidental means you are not selected. People have come, because whatever people who have joined today is incident. I can make you as a population. This is incident. I did not select. You came to the class and I am converting that into a research sample. Then it is incidental because I did not select you. Did you get the point here? Yeah. It is incidental because it happened like a natural occurrence. Because I decided to take performance whoever attended today. Did I select? No, I did not select. You joined. So that becomes incidental. It is naturally happening. Quota sample is based on the proportion what we mentioned earlier. Quota, we fix some quota. Quota in the sense what percentage of the population has to be considered depending on the size. This is called proportional representation. If the population is very much large, the quota will be more. If the population is small, quota will be low. Characteristics of a good sample, just to go through this. One of them we already have discussed. Representativeness should be there. For example, rural, urban, like that. And adequacy, sufficient sample. Other considerations goes to go through and try to answer these questions. Here you have to define what is a population, what is a sample, what is probability sampling, non-probability. This is based on the choice. This is a chance occurrence. This is choice based. Here this is chance. Chance is different from choice. Here this is based on the chance. Like random sampling. Probability is involved here. Statistics is involved here. And choice based it is non-probability. You clearly demarcate. It is chance dependent. A randomized procedure. Here, purposive. An investigator applies his own choice, that is non-probability. Sampling frame, representative parameter applied for a large population, which are established truths. This is called established truth of the population. Statistic, what we take for our purpose and study. Sampling error, if many investigators are targeting same population, each investigator comes out with one result. If you compare different investigators, there will be difference. That is because of sampling error. Biased, if you purposefully select because he is your friend or you know them or it is convenient, it becomes a biased sample. Because there is no random representativeness here. Biases may be due to imperfect tools of instruments, personal qualities of the researcher, defective techniques or other causes. Just I'll give 5 minutes break. If there are any doubts so far, you can just.
Sir, screening is different from survey, na sir? Again, screening.
Screening is different. Screening is sometimes a mandatory thing where every individual has to be screened. But in our country, such screening programs are very low.
Some opportunistic screening will be there, sir. Yeah. Opportunistic screening.
Yes. You can plan for opportunistic. That means whenever you get an opportunity in a place where you have an access to information, you are allowed to screen all the individuals in that particular units.
Yes.
Let us break for 5 minutes and again we'll come back. Meanwhile, you just cherish whatever we have done so far. Try to be ready with the questions. So we will try to answer them. Hello. Now we'll start. Here, this deals with the scales of data, research tools, questionnaire, rating scale, attitude scale, and test. Now this is more important for nutritional students, where you come across with is it visible to you? Hello?
Yes, ma'am. Sir.
Nominal. See, whenever you collect information from the population, these are the scales: nominal, ordinal, and metric scale. Nominal is the variable which is categorized but without associating a magnitude. The best example for nominal variable is male and female. Comparison between males and females. So here sex becomes nominal. Why? Because we don't associate any value to male or female. Randomly we give numbers to them, 0, 1 or 192, something like that. But we don't associate any effect there. And the ordinal, where you associate an effect or magnitude. Let us say a population is divided into 3 categories: mild, moderate, and severe. Here, mild, moderate, and severe is an increasing order, ascending order. If there is an order, ascending or descending, then it becomes ordinal. So in such cases, you start ranking the mild as 1, moderate 2, the severe 3. So the number is increasing. So it is an understanding that as the number increases, severity increases. And moreover, computer can understand what is 1, 2, 3. But if you write mild, moderate, severe and feed to computer, it cannot understand. So you need to convert that into ordinal scale. Similarly, sex, male and female, if you feed as F and M, computer will not take it. So you have to categorize into 190 or 192. If there is no effect associated, no magnitude, it is nominal. If magnitude is associated, it is ordinal. And what is the metric scale? Can anybody say? Because you must have come across metric scales many times. What is the metric scale? Can you give some examples for metric scale?
BMI scale.
Very good, very good. BMI is correct. BMI. Height, weight, anthropometry, hemoglobin. So these are all the examples. Weight, height, hemoglobin, protein quality, protein estimation, protein content and all, which are measurable on a metric scale. Characteristics of good research. These are all self-explanatory. Just go through what is validity, what is content validity, criteria related validity. Validity means correctness of information. Validity is nothing but correctness of information. Here, when you are asking questions to a subject, that is called content. Whether you have framed questions correctly, if the question is wrong, the answer is also wrong. So, content validity. Criteria, you have divided the population according to criteria. Is it correctly valid? That you have to check. Why? Because a patient who is included because of anemia, is he really anemic? You have to check the validity. You have to perform a test and do that criterion of validity. Go through them and construct attribute quality that cannot be observed directly but can be inferred from testing. See, if you just say a person is anemic, you cannot depend on that unless you go for testing. One of the features is construct validity. And when you measure the height or a specific trait, you have to see whether it is correctly measured or not. So in such cases, you have to repeat the measurement. In such cases, you have to repeat the measurement. Reliability is another parameter. So when you are taking measurements on colorimeter or densitometry, whether the value is getting repeated same for a given sample, that is, reliability is nothing but repeatability. Let us say you have measured height 2-3 times. Are you getting same value? That is reliability. If the value gets repeated, that becomes reliable. One of the parameters is to test and then retest. 2 times you have to test. And here, when you design a form, equivalent or parallel forms. What are parallel forms? The answer should be the same, but questions are different. These are called parallel. First you give one form and the other form is parallel to that, but questions are reframed. So you are going with the two. Suppose if a subject is not able to understand one question, you will give the other form. These are called parallel forms. Parallel forms are the forms which contains different questions, but answers expected are same. Earlier also we had a discussion on questionnaire and schedule also. I think I have covered this questionnaire and schedule. Can you recall? Can anybody say what is questionnaire and what is schedule? Hello? Are you able to hear me?
Yes, sir. Yes, sir.
What is questionnaire? What is questionnaire and what is... I think I already referred. Questionnaire can reach many people. Questionnaire can reach many people. It can be posted or mailed.
For gathering the data, sir.
And the researcher need not visit a subject. But in the case of schedule, a researcher should visit. And even for interviews also you must visit. But for questionnaire you need not visit a subject, you can just post it. And here you will get large amount of data, here you will get small amount of data. In the questionnaire we have structured questions which pose definite and concrete questions. They are prepared well in advance and not on the spot. So we have two types. One is structured, which we go with a pre-framed questions. Unstructured means you go to the field and frame a question. That is unstructured. Here one paper is set structured means it is already prepared by you well in advance. But this is spot. When you are sending a mail, on the spot you write the questions. That is unstructured. Structured is you already have prepared a questionnaire. Here you have not prepared earlier, but while sending the letter or mail, you type questions there randomly, on the spot, whatever that comes to your mind. Now you try to answer. Describe briefly the characteristic of a good questionnaire. It is already there. You just copy a few points here. Differentiate between an open-ended, closed-ended questionnaires. So open-ended questionnaire, here we don't give any options for a person to choose. You ask a question, let him write whatever he wants. That is open-ended. In a closed-ended, you provide options. When you provide options, it becomes closed-ended because you don't have more than that choice. But open-ended, you don't provide any options. Here something like multiple choice. Here it is fill in the blanks. Fill in the blanks is open-ended. Multiple choice is closed-ended. Are you getting the point? Hello?
Yes, sir. Yes.
Yes, sir.
Filling the blanks is open-ended because we are giving freedom to frame his own. Closed-ended we are restricting because we are giving the options. You must choose any one option. That is closed-ended. So one of the the question, a designer like this, how effective was the nutrition education session? See how trained a particular part of the population by providing them education on nutrition. But you want to see how effective was the nutrition education session, where you divide, you give the scales like very effective, slightly effective, average, slightly ineffective, very ineffective. This is based on the feedback from the people. So here they will tick any one. So based on the responses, you will come to conclusion whether the program is effective or not. But here it is looking like descriptive because we are not giving you values, no, it is descriptive. Or is it qualitative? It is qualitative, it's not quantitative. Initially it is qualitative, so they put tick here. If they feel it is very effective, they put a tick here. If they feel that it is very ineffective, put a tick here. Two extremes are there. So like that you generate responses from the feedback forms. Then when you collect information, it is in the form of ticks, yes or no, yes or no. So it is generally a qualitative information, a descriptive information. But how to convert them into quantity, you have to assign ranks. So when you assign ranks, you have to start with one number from the very ineffective 0, slightly ineffective 1, average 2, slightly effective 3, very effective 4. Like that in increasing order. When there is an increasing order, ascending or descending, is it nominal or ordinal? Can anybody say ordinal or nominal? When there is an increasing or decreasing order of the variable, depending on its effect.
Ordinal.
Very good. It is ordinal. So most of the nutrition studies will have the scales, but while ranking them, we should be very careful. So there are certain limitations. Rating scales have several limitations. For example, lenience, error of leniency. There is a constant tendency among the raters to rate those whom they know well higher than they should. Such raters are called easy raters because they pick up the questions which are easy and try to answer them. There is a constant tendency among the raters to rate those whom they know well. Suppose if you are assigning a job to your subjects and ask them to rate those whom they actually, when they rate, let us say there are 5 teachers in a training program, and you are asking students to give rating, but here they take a factor of leniency. Why? Because there is a tendency of a person to rate a teacher whom they know very well. That may not be correct. It may be biased. And they may make it higher than they should actually. Whatever they deserve, that will not be there. But if they know them, they will give. So there is something like bias. So this is called error of leniency from the subject side. Why? Because if he knows some, acquainted with some person, he rates him very well. Most of the raters hesitate to rate the individuals on the extremes of the scales. Instead, they tend to rate the individuals on the middle of the scale. This happens. It's psychological. So this psychology, even we face it when a foreign university gives a recommendation format to us. Generally, we don't touch extremes. We always go into the average category. Why? Because if you touch highest extreme, we are not sure whether the student deserves. Or if you go to lowest extreme, we are affecting the student performance. We are unnecessarily victimizing the student. So we never touch extreme scales. So such tendency is called central tendency, where a person tends towards the center of the scale. This happens many times. When the scale is given, where subject is asked to answer, they will never go to extremes. Even it is needed, they don't go to extremes. Did you get this point? Central tendency. It's a psychological factor. Do you agree or not? Hello? Do you agree or not?
Yes, sir.
We are always tended to move towards the center, not to the extremes. But that causes an error. Why? Because one extreme may be truth in the population. But because of our psychology, we are touching the average. Why should I take risk of giving higher cadre? This could be one of the errors. Halo effect is an error which obstructs the clusters of traits within an individual. The rater forms a general opinion about the personal merit or her ratings on specific traits are greatly influenced by the general impression. It results in a spurious positive correlation among the traits which are rated. If a learner likes a tutor, he or she will rate the tutor high on all traits without considering the meaning attached to a particular trait. Suppose if a learner likes a particular tutor, let us say you are all liking me. What will you do? You don't see the analytical marks there. There are several questions on me, whether he has covered adequate, whether he was comprehensive, whether he is very low or fast, like that. What will you do? If you like me as a tutor, you rate all of them equally. All the traits you say without considering the meaning. So this is halo effect. That means you are under the impression that a particular teacher is very good. So whatever the questions that are given for that teacher, you will put yes. That gives a halo effect. Because in some traits, I may be strong, but in some traits, I may be weak. So that discrimination you have to make. No one is perfect on this earth. No one is 100% right. So you should exercise your discrimination here and analyze all the points. Though you like the tutor, you have a good impression, still you have to analyze him. Why? Because it helps him to improve further, and you will be really good judge in judging the character, which is not biased. So that is halo effect. And logical error is due to the fact that judges are likely to give similar ratings for traits which they feel are logically related to each other. This comes when two questions are logically related and giving same answer, though there is a difference in questions. If there is some slight relationship between two questions, we will tend to put the same answer. Maybe they are different. The contrast error is due to a tendency of a rater to rate others in the opposite direction from himself or herself in a trait. The contrast error sometimes crops up when there is a tendency of rater to rate others in the opposite direction, contrasting from himself, herself in a trait. Why? Because he thinks that the other side is wrong. In opposite direction, he puts it. Or if he is wrong, he says the other one is right. This is called contrasting errors. Proximity error is also a possibility. The adjacent traits on a rating scale tend to intercorrelate higher than the remote ones. If there are two questions nearby, there is a tendency by subject to give higher ranks to those questions compared to the remote questions where the questions are separated. There, by the time he reaches that question, he may change his opinion. These are all psychological factors. So their actual degree of actual similarity being approximately equal. This error may be counteracted to some extent by placing similar traits farther apart from the dissimilar ones. So when you frame the questions which are similar in nature, you have to put them apart and dissimilar questions put together. So that bias is lost. If similar questions are together, the judgment also will be favoring both of the traits. Or if dissimilar ones are together, same rating will be there. But if you space it out where similar traits are separated, dissimilar ones are separated, then you will get correct rating. And there are attitude scales depending on the effect associated with a certain psychological entity. This you can read it out. And why? Because this attitude is important when you give questions like that. It is essential that we feed colostrums, the first milk, to the babies. Colostrum, the first milk from the mother. Some people strongly agree. They say it is essential. Some disagree. Some will be undecided. Some will be. This is called attitude. This is called attitude. So this depends on my attitude. If I feel strong, okay, it is essential, I put very strongly agree. Some they don't disagree. So this is depending on the attitude of the person. There is no practical logic or an evidence why he is putting that. It is based purely on your attitude. Children should be fed frequently, 4 to 5 times a day. Similar thing happens here. Without attributing any cause, a person will have his own attitude toward the variable. So these are all the problems and errors we commit and biases we commit. In the glossary, you go through what are the tools. An instrument use it for gathering data or information pertaining to certain attributes or characteristics of the individual or a group. Issues relating to a society system. So this is an example of tool. An instrument use it for gathering data or information pertaining to a certain attribute or characteristic of an individual or a group. It can be a questionnaire or it can be a measurement. Suppose if you want to measure height, what is your tool? Measuring tape. Or if you want to elicit information from a family, your questionnaire is an instrument. So there are various tools available to gather the data. Either it is quantitative data or qualitative data. You need an instrument that is nothing but a tool. To what extent to which tools does the job for which is used. The extent to which a tool does the job for which it is used, that gives you the validity. Are you measuring correctly? That is validity. This term has different connotations for various types of tools, and thus different type of validity evidence is appropriate for each. For each instrument, there is one particular validity. So a researcher has to be trained to take the measurement before they go for the study. Why? Because it should end up with a valid value. Criteria and related, I think I have already covered. The extent to which measures or scores on the tool are in agreement with concurrent validity or predictive validity, some given criterion measure. So these criterion measurements are already available through literature. Whatever you are collecting information, is it in correspondence with the criteria which is already laid out, for which you need a reference paper where already these values are established. So whatever information or measure or score you are collecting should be in agreement with concurrent validity or predictive validity, some given criterion measure, which is already there in the literature. So some criterion will be there to measure the scale. Is it falling into that criteria, that because of criteria, then it is criteria related. The construct validity, extent to which a test measures relatively abstract psychological traits or constructs. I think we have covered somewhere, just refer to which a test measures relatively abstract psychological traits. That is very effective, or they will try to touch only central values. That is construct validity. Reliability, to what extent the tool is consistent in measuring. What is consistency? Let us say you are using a measuring tape to measure the height. When you take individual height and measure on the same, it should not differ. That is reliability. Let us say you have taken one height on the same individual, repeat it. Is it consistent? Is it giving same value? Check it. If it's not giving, then the reliability is lost. So for improving reliability, you have to take the measurement 3 or 4 times in replicates. Then take the average of that. That becomes reliable. Here consistency is important. Is it giving same result or not? And usability, the extent to which tool is objective, easy to administer and cost effective. Whatever the instrument you are using, is it really cost effective? Is it meeting your objective? So that is usability. Sometimes whatever you have laid the objective, your instrument may not be able to give that particular objective. So usability is lost. Structured is pre-framed, unstructured on-the-spot questions. A term applied to an expression or opinion or judgment regarding some situation, that is strongly disagree, agree, strongly agree. That is rating. A scale with a set of points which describe varying degrees of the dimension of an attribute under observation. Here we just describe it qualitatively. Here rating scale, we quantify it with numbers. We give a scale. The degree of positive or negative effect associated with some psychological, that is attitude. By psychological object, we mean any institution, ideal, symbol, phrase, slogan, job or idea towards which people can differ in their opinion. So here, a psychological inclination will be there, because if he likes an institution, he may rate, or if he likes one ideal, that will maybe a bias, or he likes a symbol, he gives more marks for that, or he likes a phrase, he gives more, or he likes a slogan of that. So this is all biased, or a job or an idea towards which people can differ in their opinion. Attitude scale, a device that provides a measure of attitudes. It consists of series of short but carefully formulated statements or propositions dealing with several selected aspects of many appropriate aspects of issues, institution or groups of people under study. So we can measure attitudes of people using a particular scale. Then it becomes attitude scale. It consists of series of short but carefully formulated statements or propositions dealing with several selected aspects of many appropriate aspects of issue, institutions or groups of people under study. That means you develop a formulated statement or a proposition, then ask them to give their opinions on that. But this opinion is biased based on the attitude of the person, and we provide a scale there in numbers to measure to what extent this psychology is affecting. Here, rating scales are broadly classified. Numerical scales, where you have given the numbers. Graphic, the data is represented in graphic scales. And there are certain standard scales, rating by cumulative points, where you add up the numbers and make it cumulative. Forced choice ratings. Forced choice comes into picture when you have restricted options. The person is forced to tick any one. That is forced choice. That is close-ended, this thing. So with this, we'll stop it here. Now, if you have any queries in this. Hello? If you don't have any clarification, we will close it. Hello?
Hello, sir.
Shall we close it?
Okay, sir.
If anybody has questions, just we'll hold it on for some time. Achha, check everybody's answered it, written the number. Let us go to the link. Let us see how many are there here. Can you click Trilok and check how many are there today?
Sir, today 42 have entered.
42. Yesterday it was 51.
Yes, sir.
Excuse me, sir. Sir, could you please send the link again?
Link again now itself?
Just sent the link, sir.
Sent? Check the chat box. Check the chat box here. I think Trilok has kept it. I think Trilok Ram has kept it. Those who are not entered, please enter the details. Those who joined late, I think 4 to 5 students joined after the attendance is taken. All those who joined late, click this link and try to enter all the details. Enrollment number, name, and other details. 43 and one more number is there. 802, name is missing here. Name is missing. 20052 8080. Meghana. Yes, Meghana. Again, there is a gap here. Kindly remove this.
Sir, is my name mentioned? Qudsiya Fatima?
Qudsiya Fatima. When did you?
It is mentioned, sir.
It is there. It is there.
Okay, thank you.
Number 23.
Sir.
Okay.
Sir, my name Barigala Lakshmi Rekha.
Lakshmi Rekha. Your number?
Number. One sec. Shit.
No, I am not able to see here.
75079.
75079.
Not there, sir.
It is not there. Can you please enter?
Okay, sir.
It's not there. You enter it as a 45th value, 45th row.
Okay, sir.
Sir, some entered in yesterday's attendance sheet.
Please, those who have entered in yesterday, kindly transfer to present day. How many entered there? First day?
I'm just checking, sir.
Those values have to be repeated here. because it was not 60, it was only 51 yesterday. There are some extra numbers here. Maybe after 51, probably you can consider Saima Farheen. Saima Juveria.
Yes, sir.
Saima Juveri, you were there in the last class? Saima,
Yes,
were you
sir.
there in the Were you there in the last class? Yesterday?
Yes, sir. I was there in class yesterday.
Okay, then 52 onwards are the new numbers. 52, 53, 54, 55. Can you transfer it? Trilok?
Yes, sir. I'm cutting one by one, checking the duplicates.
Yeah. Maybe 52 onwards. 52 last 60.
Can you find my name? Barigari Lakshmi Rekha now? Yes.
Barigari
Lakshmi Rekha is in yesterday's sheet. 15 or 56.
You have to shift it, I think. Lakshmi Rekha, you entered in yesterday's class, not this today's. Actually, this is sheet number 2. This is sheet number 2. I think you have entered in sheet number 1. You first see the sheet. Tomorrow will be third sheet, like that. You have to count the sheet and enter there. Or we can put the dates, I think, on the sheets. We can put the dates here. Like 20.
Dates are already there, sir.
She is present, sir, in the today's date also.
Yeah. Today's date right is there.
47th. She is present.
Then yesterday we are removing it.
Okay, sir.
Why you entered in both the places or what?
Now I entered because I haven't found it.
Okay.
Before also starting I have entered.
But you go date wise, select that particular sheet. Select that particular sheet. Trilok, you have done the job?
Yes, sir. I have deleted few duplicates.
But still it is 57. Is it right?
Checking, sir.
Yesterday it was only 51, so I have to cut some more names here. I have checked it twice. It was only 51 yesterday. After 51, you can delete the names from here and paste it there. But of course, Barigala's name is there in both the tables. Maybe Shaima Fareen, Sujeevan, Satla Sujeevan, Kavya Bharati, Swarupa, Roji Kumari. These names have to be added there. Your Sujeevan name is figuring twice, I think. Is it today or yesterday's?
In today's sheet, sir. Yesterday's sheet.
This is yesterday's sheet, actually. I'm looking into that. Where the Sujeevan name, 48 is there and also 53 is there. Some repetition. So that repeated name can be cut, I think. Sujeevan is already there, 48. 48 is right, but other name can be removed. Acha, there you have removed. Okay. So Sujeevan,
because short name was there.
Yeah. That is right. And that you removed. And 52, 51 is the maximum number yesterday. ఎక్కడ పోయింది ఎక్కడ పోయింది ఎవరు కరెక్ట్ వీడు ఎక్కడ వీడు రామకృష్ణ ఎవరెవరు అంటే క్లాస్లో అవుతలేవట అంటే ఏమవుతుంది వది ఏమన్నది పోదామన్నది ఎవరు
Sir, another duplicate was there. I removed it.
Trilok, I am logging out.
Okay, sir. Today we have 51.
Trilok?
Hello, sir. Sir, am I audible? Hello,
Trilok,
sir.
I am logging out. If there are any corrections to make later on. Anyway,
Okay,
yesterday I have already stored it. I have saved it yesterday.
Okay, sir. Today 51 are there, sir.
Yeah. Yesterday I already recorded. No problem. I already
Okay.
downloaded. Right. I'm logging out.
Okay, sir. Thank you, sir.